If you've ever been told your labs are normal, so we don't see a medical problem here, then this video is for you. Because when the quality of your life is declining, but your physical exam, labs, and imaging are normal, it can make you question everything, including your own sanity. I've been there, and what changed things for me was tracking my quality of life in a way I couldn't ignore. Healthcare oftentimes focuses on survival, not how you're actually living. This is because most of our interventions decrease the quality of your life in the short term, but increase it in the long term. Think about exercise. It sucks in the moment, but overall, it improves the length and the quality of your life. Healthcare focuses on diagnosing specific diseases that impact your long-term survival. And we also are looking for diseases that impact the quality of your life, but there are many other things that affect the quality of our life besides specific disease diagnoses. Things like the jobs that we have, the relationships that we're in, the culture and the environment that we're living in. And oftentimes this can cause fatigue, anxiety, depression, and all of those things are specific diagnoses. But if you don't have severe enough depression or anxiety to require a medication, you might not want to see a medical provider for it. So if you're having trouble functioning in your daily life, but you don't have an actual medical condition that needs a medication or surgery, how exactly can you figure out what changes you need to make for your life? And that's where the quality of life tracker that I've created comes in. This helps you to notice what's actually changing, not just what you hope is helping. If you're spending most of your day in pain, exhausted, or unable to work or socialize, these normal labs and imaging aren't the whole story. So quality of life tracking can capture what tests can't, which is how illness is impacting your real life. For many of us who struggle with chronic illness, our energy is unpredictable, pain isn't visible, and your mental health definitely takes a hit just from your inability to do things that other people can do. And we may look fine on paper and still feel horrible every day. And without a way to document that, it's easy to get dismissed or undertreated. This is where quality of life tracking comes in, because it can help you notice what's changing in your life, what's getting better, what's getting worse, and are the changes that you make actually helping, or do you just hope that they're helping? It's so very important to look beyond labs, imaging, and a physical exam if they're all completely normal, but your life is still feeling off. Please go see a medical provider and make sure that you are getting all of that testing done, because sometimes we do find some very real medical issues that need to be addressed. But if everything is normal, don't just give up there and go home thinking that there's nothing you can do from that point forward. At that point, all of the power and the control is actually in your hands. And that's a very good thing, because then you can take a look at your life overall. Things like, how are your finances? How is your career? How is your job? How is your stress level at home? How are your relationships, your friendships? Are they supportive? Look at your sleep and your diet and your movement patterns and actually say, hey, are these things helping me or are they hindering me? What does the quality of the rest of my life outside of the doctor's office actually look like? I created a free quality of life tracker that can help you get started with this. You can use this data to make decisions about lifestyle changes, assess how your life is doing after medication adjustments or after surgeries, and reflect on your environment, your job, your home, your exercise or diet routine. Are they helping you or are they hindering you? And you can check in with yourself about your personal goals. Are you pushing too hard or not hard enough? Are you doing more of what really matters to you? Tracking it won't solve everything, but it can help you make clearer, more aligned decisions with your values. Honestly, this tracker is actually my favorite out of all the three that I created, because it's just for me and it helps me make decisions about the things that I can control. You can download this free tracker at Dr.GoodwinMD.com, or if you want a printed version that you can start using right away, I have a 90-day journal available on Amazon as well, and I will link those in the description below. If this helped you feel even a little bit more comfortable about your next steps, hit that subscribe button. You are not just your lab results. You are a whole person, and the quality of your life matters.